So my name's Brittany, and I'm the exercise specialist at Queen Anne. I'm from Eastern Kentucky, and I've lived there my whole life until I made the move to Washington in early 2021. And just more into my why. So I've always been a people person, and growing up in a smaller town, that kind of heightened this, and it has the everyone knows everyone kind of vibe. And I grew up playing numerous sports, and I also volunteered at the local outpatient physical therapy clinic growing up, while also being a patient sometimes, thanks to the many sprained ankles from basketball. From these experiences, this kind of led me in the direction of wanting to pursue something in the sports medicine field. And I appreciate how personal therapy could be while you're actually helping someone from recover from injuries at the same time. So I wasn't sure what specific career I wanted to pursue long term, but I just knew that I wanted something in this field. So I pursued my bachelor's in exercise and sports science. And in post-grad, I started working at an outpatient clinic in my hometown as a rehab tech and a front office manager. I just wanted to increase my overall experience and knowledge in the field. And then I made the move to Washington. And a few months after moving here, I started as the exercise specialist. And this is my first time ever working in inpatient and at a SNF in general. So I feel like holding this position for the year and a half has really increased my knowledge and allowed me to flourish in clinical knowledge overall, and my confidence as a clinician and a person. So I think after working here, it's really interesting to see all the running parts of a skilled nursing facility and the importance of the work that we do and how it's influential to our patients. So that's honestly what I wanted out of my professional career, is to be an influence and help others. Growing up in a rural area, health disparities are definitely present, and sometimes you can become immune to it because you're in it and you're living in it and you become accustomed to it, and it's just like what you're used to. So while I was away for college, and even after moving to Washington, they really started to become more to light for me. And the more I thought about it and the more it occurred, the more I just kept wanting and hoping my hometown and other rural communities across the U.S. just to have the same opportunities for access and availability to healthcare. And then working and living in Washington, on the other end, I also see health disparities that exist in more urbanized areas, and witnessed that firsthand while working with the patient population at Queen Anne. So these experiences just kept me intrigued and inspired. And at first I wasn't sure how to use this inspiration or where to put it and how to be an influence. All I know is that I want to be a part of the change and promote change so everyone has an equal chance to thrive in communities. And I would say my experiences of working in both types of areas pushed me into the public health side of things. So it inspired me, and that I could help with health policy and programs. I work towards benefiting the patients we work with every day, and families, our coworkers, and our peers, and the community as a whole. And I just wanted to be involved with that. So I'm now pursuing my master's in public health at Eastern Washington University. And I also want to say that Infinity Rehab has also been a promoter for change with the DEIB team and all their efforts that they've put in. And being a part of that team has allowed me to be a part of something that creates a safe and inclusive workplace for all employees of Infinity Rehab. So just with all of these experiences with personal and professional over the past few years, in all, I just hope to and want to continue being a part of an influence to those around me and a part of change. And with that being said, I feel like if I want to be an influence, I should have to give a shout out to those who are influences to me. My family has always been a big influence for me from the very beginning. And also my Queen Anne team, my work family, they set me up for success from the very first day. And I feel like they're truly the epitome of what a clinician is and what they should be. So I'm very grateful for my experiences and with Infinity Rehab, and I'm looking forward to the future with them too. So thank you so much for having me.